And our next speaker is Jakob Boije, and he's visiting us from New York City. Is that correct? Okay, and he is the president and partner of Veryday, Inc. He's here to talk about a collaboration he had with Experio Lab and how it influenced patient-oriented service innovation for a national center in Sweden. Is that correct? All right, thank you.
Hi, so I would like to introduce my friends here, also Thomas Edman and Per Hanning. Maybe you can just let you in on your own names. Yeah. So you go
I'm
ahead.
Thomas. I'm Per.
Amazing presentation. What do you do? Who are you? Richard, real quick.
I'm the manager of Experio Lab.
Yeah, and I've been running this project.
Okay, cool. So thanks for listening to this. So we're going to present a bit of a story of how we are trying to change the kind of service innovation game in Sweden. So we will do that by just give you a quick introduction of Experio Lab and Verde, and then head into a patient journey program that we've been working on together. So we will kick it off with Thomas.
Okay, thanks. Now you switch picture, and you said service innovation there, so just shortly on what we mean with service innovation. There's been a lot of talk about those silos over those last days. And for us, service innovation is about focusing the whole patient journey through the system over those silos. It can also be sort of over organizational boundaries outside the healthcare system. Experio Lab is quite a new initiative in Sweden. We started in October. We started in a regional healthcare service. Sweden has only public healthcare, maybe you know, and it's sort of divided in 20 different local or regional healthcare organizations. And we started in one West Sweden called Värmland. Wow, okay, it's really dark. That's nice, nobody can see me. That's good. So we started there, but we have national funding to build the Experio Lab. And what about Experio Lab? It's the first try in Sweden to embed a human design-centered approach to healthcare, to build, to run projects and find new learnings how to implement, also on an organizational level, design thinking or user-centered design or service design or whatever you like to call it, into a healthcare organization. So what we do is that we run, I don't know, we started in October, I think we're up to 15 projects at this point, directly with patients, relatives, doctors, nurses, what have you. Because one of the key things with services for me is that the value of service is co-created between patients and personnel or staff. So of course you must engage both of them, or all of them. So yeah, you're going really fast, or maybe me too slow. We have sort of three key things that we try to do in all projects, and one was the last picture, to start with empathy for real people, so to go back and try and understand what people actually experience. That's why we call it Experio Lab. To start with people's experiences of healthcare and how they live their life, and really understand that before we go into a project. And the next thing is to have the courage to dream about better solutions. Sometimes we feel that we get stuck with sort of incremental development, and sometimes you need to rethink stuff if you can do it in another way. And again, the start for that is to understand what people need and how they do. So we try to have the courage to dream and involve different kind of people in setting goals and try out new things. And try and actually do things is the way we do it. So that will be the next picture. For us, it's really important to actually do. We sort of try to do our learnings by running projects and actually engaging with people in their daily life or out in their different divisions, and try to be collaborative. Because for us, that's the way to both to be innovative and create a new solution, is to engage all stakeholders in the same process. That could be patients, the relatives, the doctor, the nurse, or even people outside that particular healthcare system. It can be transport, it can be banking, it can be insurance, it can be other things. So that's a little sort of background on Experio Lab. And now we're going to show one of our projects that we did together with Jakob in his...
So the slides are a bit dark here, but sorry for that. But real quick, Verde is a people-centered design agency working with healthcare primarily. We do lots of other things too, but in this context, we will try to explain a little bit about what we think about the kind of healthcare space. So, what do we mean by people-driven healthcare? We think that it needs to be democratized. People need to have access to care, to access to data. You need to be collaborative. So a lot of different stakeholders can come together and co-create. We do believe that some sort of personalization needs to be there, and also it needs to be accessible anytime and anywhere. So the methodology to go about co-creating people-centered healthcare services is really about trying to step out and look at things more holistically. And also, like Thomas just mentioned, working with experienced prototypes. This is real time, this is services we're talking about. Things will change, you need to actually try them out. And also, really important that human empathy about other people, about yourself, and how you interact with others in the system is really key. So, real quick, Patient Journey Project. We started off by trying to figure out ways to get stakeholders to have a kind of more empathic understanding of what's going down in the healthcare system. So, the aim is really try to get to improved patient care. We saw all sorts of other interesting effects of this program, but the main objective is really to improve patient care. So the starting point, as we heard over the course of these few days, the system is really disjointed, it's inefficient, the patient experience not really that satisfying. There's high cost of transferring patients. So in Sweden, in particular, there's it's divided into a primary care system, and it's kind of a public system, and a more home care system. And moving people between these two systems is pretty expensive. And also, we found that there's poor utilization of resources across the system. So that's sort of the starting point. Unfortunately, you can't see these people here in the slides, but there's a multitude of people, and they basically stepping inside the shoes of the patient. So the setup here is that over the course of 8 weeks, different stakeholders were to reenact the patient experience. So in this case here, we have a person called Ulla, which we'll see a little bit later on, some description of her. And she is now enacting out or actually experiencing what it feels like to go through the healthcare system for a couple of days. And the journey started off with really going from a first acute care and being transported with real life, ambulances come and pick them up, and walking through different types of all sorts of hardships within the system, ending up at the primary care center, meeting all sorts of different people, and basically feeling all the things that a real patient feels like. So the key here is also that the team is consistent of many different stakeholders. They have come from different perspectives, and the point of this is really for them to do this, experience this together. As you go through the experience, they can then go back later on and have conversation on what actually went down. So over the course of these 8 weeks, this group then came back in and started mapping out the experiences and the things, the insights that they found. And initially it was somewhat, not to say resistance, but people were a little bit like, should I spend my time on this? Is it meaningful? But over the course of these weeks, they found that it was more and more interesting, and as new insights start coming up. The starting point was really 3 real patient cases as we try to create or recreate these experiences as true as possible. So there's 3 patient management cases. Then that became the kind of the structure of the journeys that we went through. And I'll show you a little quick clip here. So essentially, people were equipped with GoPro cameras on the chest, and some people were wearing foggy glasses, gloves, other props that would pretty much simulate the experience of not having full dexterity or being that well equipped to go through the healthcare system. So again, about empathy, to really put yourself into the shoes of a real person. And this was a really powerful thing. There were some real frustrations being built up. So the people that were trying this out, they could really feel with a real person in the end. Some of the discoveries and findings as they start mapping this out. For example, so up here we have kind of the patient perspective. Down here is the organization operations. So one thing was there's a disconnect between the operational and personal needs. And also that people really, they need to see me as a person, not an object. But at the same time, don't want to be burdened to the system. So there were some conflicts in there that's pretty interesting to think about. The organization also managed to pull together a lot of data, but they don't necessarily know how to act on it, what to do with that data. And also that the organization is really not set up for collaboration. The way it's structured today, in the hierarchy and also the different units, they don't actually collaborate. So that's also a bit of a stepping stone. So the takeaway is stepping into the shoes of patients is a really powerful way of highlighting these shortcomings in the delivery of care. What's interesting too with this, so it's hard to see here, but Göran Hägglund up here, he's the Sweden's Minister of Health, and he was also part of this. So both policymakers and basically the guys that created the system were put through the system. And this is also a really powerful way of setting it up for continuous conversation on, hey, here's the things that we found, what can we do to create this better together?
So what did we learn about this project? Well, we found out a lot of problems, of course, or things to improve. But I've been listening to you here in the United States, and you have exactly the same problems as we have in Sweden. So, but we found something else, which I will show you. We're building empathy here. The guys doing this journey, they didn't just do the journey, they did an inner journey. They experience things, they feel, they see things, they do things. Take next. They start to understand the system. They understand suddenly that one action in one part of the system has or can have great impact on another part of the systems. When you're a patient, you don't need to be critic about the healthcare, or you don't need to defend. You can make critics. Sorry. You have hierarchies here in the United States? You know, like doctors, assistant nurse? You don't have? We have it in Sweden. So, but if you let people be the patient, they don't need to have the hierarchy thing. Oh.
So that was one of the fun things, to actually have the social minister of Sweden doing the same journey as a nurse. It's quite fun. He wanted him to be the patient, but he didn't dare.
We're also, like you've been talking about silos here, and I think this is a great way to have people start talking and doing things together, and we're really breaking the silos here, I think. And one of the most important things, I think, is having fun. You know, you should never underestimate the power of having fun. So we've been giving 28 people the opportunity to take the patient perspective here, and they will always have the possibility to take this perspective again. And this is Ulla Rami. She has been a nurse for 40 years, and she will tell us her story about this project.
First of all, I have to be honest, when we started this journey, I thought, like, oh my God, 8 weeks of meetings every Friday morning. During that journey, I've started to look forward to the Fridays. I've been surprised by my own feelings. I got to play the patient. I've been a nurse for 40 years, so I thought I knew what the patient needs, feels, or wants to experience, or how to treat them. And suddenly, when I put my non-seeing eyeglasses on, I became this old man, Ove. Mostly I realized I was quite alone during the journey. I didn't feel safe, which reminds me when I work to make sure that my patient is safe. It also made me realize that we talk about patient in center. In Centrum, we are to look at things from the patient's point of view. We don't do that. The patient is there, being transported around, and sometimes it feels like we have more respect for the doctors than for the patient. If somebody had told me this, it would have been, okay, another 15 minutes to go, and I know this, I've been here for 40 years. I think I know this. And if somebody had told me you don't know it, I might have been offended. But this came as a surprise, and I really had to put myself into the poor man's position. And also, I think everybody should go through this journey.
So what's interesting here is the approach, taking a patient-centric approach, and the entire model sets you up to understand specific insights that will provide a platform for more long-term strategies. So really about creating, specific targets for initiatives can drive things on a systemic level, and this is powerful stuff. So, but it also comes. So one of the takeaways here is this bottom-up thinking, by really looking at how people act in real life and what's going down in their lives, provides people that's supposed to decide future visions and drive future programs with a whole different new set of constructs. So if the current focus is specialty, the adaptive focus is really about flows. You go from organization to collaborative work practices. And instead of being run necessarily by resources only, you have a focus on running by needs. And there's initially a huge focus on co-workers, but then really patient first changes the game too. And what's interesting, I think, is instead of necessarily adding resources, to identify what resources already exist and how can we make those more effective and better utilized. So the same thing with lowering costs, could be instead be decreasing waste and going from budget to quality. So this is something that we see now as a continuation of this program, that it has shifted the mindset in the way that we'll manage future programs. So patient-centric approach will hopefully lead to better outcome. Thanks.
we are running a little behind schedule, so if we'll limit it to about 2 questions. Yes.
I love that quote about dryness and changes. And I was so curious, why do you think this? What is that black box in between? Why is it that you such a powerful generator for change?
I'm not sure I heard all the way over here. So what was the question again? Sorry, could you make it short?
I just wondered why do you think, what is the black box between patient-centered that can affect the entire system?
I can quote one of our doctors saying, we had a focus on patient for a very long time, which easily could mean that we are 6 doctors watching the same patient, which is not the same thing as being in the patient's shoes. That's at least a bit of the answer, I think. You need to do stuff to actually understand and be empathic and understand the patient's needs. And again, actually, the last picture of all one of the last pictures is actually, what do you say in English? There's a new thing, there's the steering program for our entire healthcare system regionally, how we want to change it. And then there's a part from this project to try and go there and again understand it's a service, and the value of the service is co-created between patients and personnel. So you have to engage them. I don't know if the answer to the question, but something like that.
Last question? I want to ask you a question. So what was the minister's response going through this process?
Yeah.
Well, we wanted, like I said, we wanted him to be the patient, but for some reason, because there was lots of pictures taken, and he didn't want to be photographed in his underwear, I think, so he didn't dare. No, but he actually, he was really taken by it. And the man you saw in the picture, he's responsible we have a national organization, so he's sort of the top manager for healthcare in all the county councils. And he was also really taken. A fun story maybe was that we tried to play out the scenes as proper as we could. So when there was an ambulance involved, we actually had an ambulance. And we played out a session with the minister in our administration building. That's where we sort of made the accident happen, and he fell down and broke his leg or his hip. And we drove up an ambulance to the building, and we took out, he was the chief then, top manager at that time. So we brought him out on the stretcher through the lunch diner. And nobody knew, and it was a big thing. Nobody really knows, what's happening.
Nobody knew it was a...
No, we hadn't told, sort of just the few people that were involved in a specific project. So, and it was right during lunchtime, so we had like 300 people watching. We came with an ambulance and top manager on a stretcher. And
guy's a goner.
Yeah, he's gone.
The minister said, right here, he said, I'm out every week on something, and I often forgotten the things when I leave.
So I think that might answer the question about systemic change. This is really powerful stuff. It might look simple, and it is pretty simple to do, but it's hugely powerful.
All right. Thank you, gentlemen.
Thanks.
Thank you.